I think as a little kid, you look up at the sky and it's awesome.
Flying high was always part of Joshua Sager's life plan. He would become a well-respected Navy fighter pilot on his way to a squadron commander title. He had found the girl of his dreams. But just before finishing up his master's degree work at Naval College, he noticed some irregular bleeding.
The initial reaction was, hey, you're flying, you fly for the Navy, you're pulling high Gs, that type of performance, it's probably hemorrhoids.
Doctors would eventually recommend a colonoscopy, and Josh was told he had stage 3 rectal cancer.
It's a life changer. It's not what you expect when you're 36 years old.
There are about 40,000 new cases of rectal cancer each year in the U.S. It's as common in men as women, but usually doesn't strike until over the age of 40. Having a family member with the disease also increases the risk. While Josh's cancer was mostly contained, it had begun to spread. He wasted no time marrying his love, Jessica, 11 days after diagnosis. Many questions swirled in his mind.
Most importantly, am I going to be alive, at this point next year?
Treatment would need to be swift. He was sent to the renowned rectal clinic at Beth Israel Deaconess Medical Center.
It's complicated when you find out you have cancer. It's scary for patients, and it's difficult to know where to go and how to manage things. And specifically in the area of rectal cancer, several different kinds of treatment can be needed.
We have a CT scan from here.
Okay.
Treatment for rectal cancer usually involves chemotherapy, radiation, and surgery. At Beth Israel Deaconess, all of the doctors involved in the case meet prior to the patient's visit to discuss options, then meet with the patient together to develop the best plan.
So I basically met my own team of doctors, basketball team, I guess, sized, but met them all on the same day. I mean, literally from the time that I got my diagnosis to meeting the team of doctors here at Beth Israel Deaconess was a matter of days.
Josh's treatment would include 28 sessions of chemo and radiation over 6 weeks. He would then have surgery to remove the tumor and part of the rectum and lower colon. The procedure was performed laparoscopically with several small incisions instead of one large one.
Minimally invasive surgery is really about quicker return to quality of life. Patients can just bounce back faster. They have less pain, they have less fatigue overall, a quicker return to a sense of well-being.
But the worry for patients goes beyond the cancer that must be removed. This surgery requires a stoma, an incision in the abdomen, and that means an outside bag attached to collect waste. Most stomas are temporary, but many surgeons will keep them through the entire treatment, up to a year. Dr. Nagel's team strives to remove it as quickly as possible.
First question that everybody has, no matter whether it's a colon cancer or a rectal cancer, is, am I going to have a bag? And so in order to minimize the impact on the patient and make the long-term treatment, especially with chemotherapy, as easy as possible, without compromising quality, of course, we attempt to reverse the stoma within 6 or 8 weeks of the original surgery.
After having a second surgery to remove his stoma and reconnect his intestines, Josh endured 6 months of additional chemotherapy. Despite the long process, Josh is grateful to the BIDMC team for taking the time to understand his situation in life, his occupation, and the will to continue flying. They also knew he wanted to someday be a father.
They took a lot of precautions and gave a lot of advice that I used over the next few months. For example, going to an IVF clinic, doing fertility preservation, aka going to a sperm bank, and taking those precautions, because it's something that you wouldn't think about that the hospital has seen, that they know to tell you, and they set everything up, they coordinated it all. I think there's a partnership with Boston IVF, so that was nice. It was taken care of, and it's something that probably for the rest of my life I'm gonna be thankful that they pointed out. Now
cancer-free, Josh is back to flying high and living his dream.
This is as big a journey as the Navy's ever been. It's a life changer, but like I said, there's a silver lining of the cloud. There's I think a positive attitude, and having a supportive family and friends, and obviously having a great hospital and a great team of doctors. It's been awesome.